very good evening, everyone. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their life. Urticaria is characterized by round rash on the skin, which itch intensely. It may be due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per a study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years. Incidence is higher in the older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its type, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Sumit Haldar, is a distinguished dermatologist based in Kolkata, India. With over 3 decades of experience in dermatology, venereology, he earned his MBBS in the year 1986, followed by an MD in dermatology and venereology in 1994, and was awarded the Diplomat of National Board (DNB) in the year 1995. Dr. Haldar currently practices at Calcutta Skin Institute. A warm welcome to you, Doctor. It's a pleasure to host you today. And today we are going to discuss about a very important topic, which is the management of urticaria. First of all, I would like to ask you, in your language, would you like to describe what is urticaria?
Urticaria is basically an evanescent reactive pattern of the skin which is characterized by redness or erythema, wheal, that means edema, and also itching. These three are the main symptoms by which it is characterized. And the most important point that I have just now mentioned, it is evanescent, but it appears and it disappears spontaneously. So any skin condition which appears and disappears spontaneously, 100% chance that it will be urticaria.
Right, right. Now, because the causes are vast, we already know about it. A thing that can appear all of a sudden, disappear all of a sudden. Mostly people tend to ignore such things. Can we talk about few of the causes behind urticaria, doctor, which are most commonly seen?
Actually, just in the introduction, what you have told, it has been classified as an acute and chronic. The causes for the
Mm-hmm.
acute urticaria is different from the chronic urticaria. In acute urticaria, we will be searching for any underlying infection in the body, or whether it is drug induced. These eruptions are drug induced. These two are the main important points, and infection also. These three important
Mm-hmm.
points as a cause for acute urticaria. In chronic urticaria, the causes are sometimes may not be delineated. In those cases, we are call it as an idiopathic urticaria. But sometimes there may be some cause like underlying systemic disease in the body, or there may be sudden food exacerbation can be there, and very commonly the cause is hypothyroidism. Thyroid disorder is a
Mm-hmm.
very important point. So these are the few points which are important in chronic urticaria. So acute urticaria and
Right,
chronic urticaria causes are different.
right. Now, let's quickly also talk about the formation of urticaria, doctor. We know it form in a round rash-like pattern, but can it also look like a mosquito bite?
It may be of different shape and size. The
Mm-hmm.
spontaneous urticaria, what appears in the body spontaneously. There may be a symptoms like itching, and there will be whealing or erythema and swelling in the body. It appears
Right.
spontaneously. Spontaneous urticaria, it may present with different shape and size, bigger plaques, and it may be small, minute, small insect bite like or mosquito like bites also may be present. There are certain different other morphological types are also there in urticaria, just like in, just for example, dermographism is a type of physical urticaria where the patient may have a linear pattern of wheeling uh, according to the scratch line, or the patient can write their name also in this way. So this pattern is actually is a linear. It is not rounded or oval in shape or in a bizarre shape. It is usually linear. So this linear pattern is also sometimes may be present. Sometimes wherein the patient may have a small eruptions like mosquito bites all over the body, and it
Mm-hmm.
disappears, and it usually precipitated by the rise of the core temperature of the body, which in that case we are calling it as a cholinergic urticaria. So articarial morphology, clinically it may be different. It may be globular, it may be oval, rounded, of different shape, of different size. It may be linear, it may be very small insect like lesions.
Right. Now, all the people who are watching us right now, most of you might be thinking that at any point in your life, so till date, you might have seen such lesion in your body or in your skin. So, the
Yes.
best thing you can do when you see any changes is visit your nearest expert so that you do not go for any over the counter medications. Well, we will also talk about the over the counter medications. But before that, doctor, let's know that how do we treat it? Firstly, how do we, whenever we see such conditions, such the patients with such condition, what is the first thing that we do? What is the first thing that we suggest
the,
them?
the first important thing, we have to go for a detailed history of these eruptions in the body. If it is less than 6 weeks of duration, we call it as an acute urticaria, and if it is more than 6 weeks, it is usually called chronic urticaria. In acute urticaria, you have to take a very detailed history where there is any history of drug intake prior to these eruptions. Was there any outside food taken by the patient within previous 2 3 days before the rash appears, and any infections we have to find out. We have to clinically examine just for like the patient have a kidney state. From there it can happen also, or maybe a prior tonsillitis infections may be there. So this type of infection, whether they are present in the body, these are the very important points for pointing out the urticaria in case of acute. Chronic cases, if it is chronic, then we have to go for some test also, mainly for the thyroid function test. And also it may be because of a chronic infection which is going on the body. That's why we are doing C-reactive protein, CRP. These two tests are very important. And we have to take history whether the patient's having any physical urticaria. Physical urticaria means a urticaria where it has been induced by some physical agents like temperature, cold, rise of body temperature. That's now I've told about cholinergic urticaria. In these cases, physical factors which are these are present or not. Vibration is maybe a factor, pressure may be a factor. So these physical factors we have to take in the history in details, and we have to go accordingly. Main treatment aspect is with antihistamines. If there is infection, we have to give antibiotics or antibacterials, and we have to wait for the results on how the patient responds to that particular treatment. If it is not, then we go to the next step of treatment.
Right. So this applies for both acute and chronic urticaria, doctor?
Yes, history is, it is very important. There is
And
another important type of urticaria, which is not actually called urticaria. It is called angioedema. The mechanism is the same, but only the involvement of the skin will be much deeper. That is in the subcutaneous tissue. There we are calling it as a angioedema, and that angioedema again may be associated with the urticaria. So urticaria with angioedema, and there may be simple case of angioedema without any urticaria. So these two distinction is very important so far as treatment is concerned, because urticaria with angioedema it may coexist, and there the treatment will be like urticaria. But angioedema without urticaria, we have to go further details whether there is any familial tendency to have this urticaria, or there are it may be features of underlying disease like SLE on others. So we have to go for the test for other systemic diseases. We have to examine for that also. So more or less, history is very important, and the first line of treatment in both the cases for acute and chronic, it is the same.
right, right. Now, when we are talking about skin condition, a lot of people wonders if it is contagious. What about urticaria, doctor? Is it contagious?
Not at all contagious. Not at all contagious.
Right,
It
right,
should be conveyed very clearly that urticaria is not contagious.
right, right. What about genetic history? Can we see any genetic history in such condition?
Yes, yes. There are certain cases where there is genetic predispositions are there, and there
Mm-hmm.
are genetic defects are there for that the urticaria that will usually appear generation to generation. Just now I
Mm-hmm.
have told that money that angioedema. Just now I have told there is a
Mm-hmm.
condition called hereditary angioedema. These runs in families from generation to generation. So there definitely a implication of genetic factors are there.
Right. So, what for people with such genetic history? People who are watching us right now, a lot of people might have seen their parents suffering from such condition. Any prevention for them or any precautions for them which they can take in before they get the condition?
First of all, they have to show to a dermatologist, and it is the dermatologist's duty to find out whether there is any familial history of that type of urticaria, and if it is so, it will be confirmed by the blood test mainly. And then they can also, and that particular condition is quite severe, they cannot breathe properly in hereditary
Mm,
angioedema. So there may be an attack of suffocations, and it appears time to time. Any trigger, suppose somebody is clearing their throat by putting their hands, and there may be a precipitation of hereditary angioedema. In those cases, we have to treat very rigorously, and one particular medicine has to be kept always with patient so that the patient can take that medicine immediately to save the life, because if it is prolonged, there may be chance risk of life also.
right. So people right now might be wondering how is it possible that a skin condition can be this worse? So, doctor, also tell us what if people are neglecting the condition? They're just avoiding it. They are just prolonging the condition. What can be the worst case scenario in such cases?
Not, thing is that the patient if the patient usually they don't neglect actually. When they are
Mm-hmm.
suffering from a lot of itching, they usually report to the skin specialist. Actually there is
Mm,
no chance of getting doing neglect to this particular condition. The patient will be suffering from itching, and it is very quite bothersome. It hampers the daily life also. So that's why the patient usually seek advice uh, very often. They don't neglect actually. What they
right,
can do, they can mix use by taking medicines without doctor's advice. From the
right,
pharmacy they can take medicines. That sometimes create a problem, what type of medicine they are taking, They don't know about the medicines and they are taking it. That should be prohibited. That should not be allowed. That should not be accepted also.
Right. So, well, few things we need to keep in mind when we're talking about urticaria. We have understood so far from Dr. Haldar is to avoid the triggers, right? We need to stay
Yes,
away from the triggers. We need to understand the triggers, stay away from them. Stay away from over the counter medications. Any sort of medications which you have seen people using around you suffering from the same doesn't mean that it will suit you. So, as we know that the causes are different, in the case of urticaria, there are a vast number of causes, and sometimes the causes are also unknown. So, in such cases, visit your nearest expert whenever you see such kind of changes on your skin. Now, speaking about skin, doctor, we in recent study we have found that stress has to do a lot with skin conditions or hair conditions. So, does stress also play any role in the case of urticaria?
of course, of course. There is. There is a very rare condition in the urticaria which is called adrenergic urticaria, where the
Hmm.
patient has some mental stress and the patient starts getting wheel on the body. So there is, if there is any mental stress and the patient may get, it is a very, it is, though it is not so common, it is rare, but it can happen, adrenergic urticaria, and that particular urticaria is definitely associated with mental stress.
Right. Also, tell us, doctor. We know that to have a healthy body, to have a healthy mind, is what our experts always suggest us. For that, we need to maintain a good lifestyle, a good food habit, uh, include physical exercise every day in our daily routine. So, what if a person is already suffering from urticaria? He or she is staying away from the triggers. Um, can he or she also be advised to do such physical workouts in the case if he
It
she
does
is
not,
already suffering from the condition?
it does not have any direct correlation.
Okay.
Keeping yourself healthy by doing exercise, taking a very leading a disciplined life and taking the foods which are not having the triggers, it is okay, but
Hmm.
directly there is no relevance. If I stay very disciplined in my life, if I have a very
Hmm.
good lifestyle, that doesn't mean that may not have urticaria. I can have urticaria anytime, anywhere. So it is not directly related.
Right.
Okay.
Now speaking. Yes. Yes. Sir. So, so speaking of that, is there any sort of urticaria, because we know that the causes are vast, any sort of urticaria which can be related to workout, like people who stresses out their skin a lot, who sweats a lot? Are there any urticaria which can be caused from the same?
Yes, yes, there. That is that just now, just before I have mentioned that physical urticaria. So the
Mm-hmm.
urticaria is precipitated by uh, increase in the core body temperature, and also by stimulation by heat, stimulation by exercise, is stimulation by food and heat and exercise. All these are the physical factors by which definitely it can induce. So there are a lot of physical factors that can increase the physical urticaria.
Right. Um, now, again, coming back to the same point, everyone, you need to find out the trigger when we are talking about urticaria. The first and foremost thing is finding out the trigger and avoiding the trigger. The only thing that can help you is that. And for you to find out the trigger by yourself becomes a bit of a task. So I think you should always visit your expert, go through a routine checkup every single time. Today we are talking about urticaria, but irrespective of the fact that you're suffering from any condition, any disease, make sure you're monitoring your health. You're checking your, keeping a check on your health, on your body. It's very, very important. Now, quickly diving into the next topic comes from a viewer who asks, can weather changes cause urticaria? Deepak Saxena asks question.
Yes, if there is any heat, there may be chance of urticaria if the person is suffering from cholinergic urticaria. weather change, if it is too hot, if the person goes outside and the body temperatures uh, tends to rise, and there will be chance trigger, that may be a trigger, and that can have an urticaria. Similarly, if a
Right.
person is exposed to cold or the cold water, cold air, suppose the person is going by a two-wheelers sitting on the back, because of the cold exposure of the air, there may be chance of urticaria. So definitely weather is has a role, definitely.
Right. Now, there is also a kind of urticaria, which I personally, in my experience, I have seen, is caused by rainwater. Also, we have seen solar urticaria. So, in such cases, doctor, how do they avoid the sun? It becomes a bit of a task to avoid rainwater or the sun. What to do in such cases?
uh, Regarding rainwater, there is nothing just to avoid by taking umbrella or raincoat like that. In case of solar
Mm-hmm.
urticaria, the patient has to protect themselves by using a broad spectrum sunscreen agent, and with that they have to take some oral antihistaminics to prevent the eruptions of the urticaria, and covered cloth, all those things that has to be taken care of. Sun protection cream, broad spectrum, covered cloth which is tightly
Mm-hmm.
woven, that is very important. The people are using
Right.
sometimes very loosely woven cloth, and the sun rays passes through the cloth, it won't help to prevent urticaria. In that case, is tightly woven cloth, uh, covered cloth. These are very important. Broad brim hat. These are the things sometimes is required.
Right.
Sun protection
Right.
is the main thing.
Right.
I want to add one thing. Nowadays, food is a very important factor,
Mm-hmm.
especially for the acute urticaria and sometimes the chronic. We see uh, acute onset, acute onset in a chronic urticaria. The patient remains better, it is controlled, but suddenly there is flare up, and there the implication is maybe from the food. So the patient who are having urticaria, they should be alert regarding certain types of food which they themselves can start avoiding before seeking advice from the doctor. The foods like
Mm-hmm.
any artificially colored food,
Right.
like uh, laddu, yolo laddu,
Mm-hmm. Okay.
different color of sweets, different color
Mm-hmm.
of syrups and drinks. Nowadays, in summertime, the
Mm-hmm.
people are taking a lot of drinks. Uh,
Right.
so that it may be colored red or yellow or different color. This artificial color
Mm-hmm.
can do that. That one. Next is the food with preservatives. These preservatives also can cause urticaria.
Right.
Like we can have a preservative in butter, we can have preservative in noodles, we can have
Mm-hmm.
preservatives in lot of chutneys and sauces which are available, tin food, tin sausage, tin rasgulla, these are all having preservatives to increase the shelf life. So this preservative is a very important factor in the food that can cause color, preservatives, and also the fragrance, the essence
Right.
in the food, like the
Mm-hmm.
mostly the bakery foods, cake, pastry, all those things have a lot of essence. So this essence
Right.
can also give rise to this. So regarding the food, and also there are certain food which are directly are muscle disrupt, that can disrupt the muscle, and they can directly release the histamine. I'm talking a little bit about
Mm-hmm.
the pathophysiology. So these muscle
Right.
stimulator of the muscles, those type of foods has to be. Just for example, tomato is called a pseudo allergen because they don't take the origin directly hit the directly hit the muscle and cause release of histamine. So tomato, these are the very important, peanuts or any sort of any kind of nuts, mainly peanuts, banana, these are the foods that has to be avoided, especially in acute
Right.
urticaria. If the patient have urticaria, urticaria is very easy to diagnose. It does not require any
Mm-hmm.
doctor's advice. They can itself understand that it is coming as an urticaria. So then and then they can stop and they can avoid these foods before going to the doctor.
Right. Right. I think everything, doctor, which you have mentioned right now, if we see as a whole, if we avoid such thing from our life, generally also, even even if we are not suffering from the condition, just generally eliminating such things from our diet, from our life, can make your life so much simpler. It can make your health better. It can help you grow in a wholesome way. आप देखोगे जितने भी खाने में जितने भी ज़्यादा इनोवेशन, जितना बेसिक आप रहेंगे, उतना ज़्यादा आपका हेल्थ अच्छा रहेगा। ट्राई पीपल आर मेकिंग अ मार्केट, मेकिंग सो मच मनी आउट ऑफ ऑर्गेनिक थिंग्स नाउअडेज। नो मार्केट थिंग्स आर चेंजिंग वाइडली, like the hybrid vegetable is much more cheaper than the organic one. Though it should not have been like that. The world is changing widely, but we do not need to change. We should stay basic, stay connected to your roots, eat whatever you have been brought up eating. So try and avoid changes, especially with your food, with your diet. Get good sleep, stay away from stress. You will see your health will improve with time. And of course, always stay connected to an expert. Now, quickly moving on to the next question, doctor.
Yes.
Nowadays, we are also getting to hear about COVID, the rise in COVID cases. I don't know how true is that, but coming back to the same topic, we are talking about urticaria today. Tell us, can COVID also cause urticaria at times?
Yes. Yes. It can present with urticaria rashes. It can
Right,
present with
right,
urticaria rashes.
right. Well, with that, doctor, let's also quickly know about the treatment options which are available for urticaria currently.
Treatment option, the thing is that the mainstay of the treatment is antihistaminic group of medicines. There are
Mm-hmm,
different types like first generation antihistaminics, second generation antihistaminics, but these antihistaminics are mainstay. We are now using more of second generation antihistaminics because it has a less side effects, it causes less drowsiness, it causes uh, the consciousness and the alertness of the patient remains better. They cannot sleep during the working hours. They don't feel sleepy. So that's a very important point, and that's why the second generation antihistaminics are nowadays very important. There are different types of antihistaminics. I am not going in details. That is a doctor's preview to understand and to write about it. And
mm-hmm,
if it doesn't help, then we go to the next step. Sometimes the first generation and second generation both together we can also sometimes try. Other than that, we have to go, sometimes it is not always, we can give a very short course of corticosteroids oral, but it should not be continued for a long time because of its side effects. And then there are other, the third step or the third step in the ladder. There may be cyclosporin is a drug that is used. Recently one biologic has come in the market, omazumab, that is also being used. So we have to go step by step. If the patient does not respond in the step 1, then we have to switch to step 2, then to step
mm-hmm,
3. In that we have to continue. But remember the acute urticaria, as it appears very suddenly, and it
mm-hmm.
also resolves very quickly. So
Right.
in that case, it is not very a problematic one. You have to find out the cause, but it usually rapidly disappears. But in a chronic cases, that is quite cumbersome, quite difficult to treat sometimes. The patients may not have a discernible cause, So those cases we are called idiopathic urticaria. In those cases, we have to go for second ladder of treatment, second step of the ladder of the treatment, or the third step of the ladder of the treatment, cyclosporine and omazulimab. And there are two different tests very important nowadays, like
Mm-hmm.
anti-TPO antibody, which is a thyroid related antibody that we have to test for it, and we have to test for serum Ig level. And these two particular tests dictate us which way we'll go. If Ig is high, then we will be going for omazulumab, and if it is a TPO antibody high, we are going for the cyclosporine. I'm not going in details. It is absolutely a medical aspect. Uh, just a nutshell I have described.
Right. Well, doctor, tell us. We are particularly mentioning again and again about acute urticaria, about chronic urticaria. How do how do a patient from acute urticaria moves to chronic urticaria? What can be the scenario in such cases?
Now,
Why does it happen?
basically, it has been arbitrarily divided according to the duration of urticaria. If it is
Okay.
more than six
Mm-hmm.
weeks, then we will be calling it chronic urticaria. If the urticaria
Right.
appears and the duration is less than 6 weeks, then we will be calling
Mm-hmm.
acute urticaria. But there are situations where we will be getting acute on chronic urticaria. That means the
Okay.
patients are having urticaria intermittently. There may be quite a
Uh-huh.
prolonged phase of remission, but suddenly there is flare
Right.
up. So that is called
Okay.
acute on chronic urticaria.
Okay. Okay. Doctor, is it also possible that the condition has just shown once in somebody's life, entire life? The person just had once been flared up on the condition and never ever. Is it possible?
Can you repeat the question once again?
The
Can you
question
repeat
is,
the question?
doctor, sure, doctor. The question is it possible that the patient in his or her entire life has been through the condition just once and never ever?
Can
The
happen.
condition has just flared up once and it just disappeared forever.
Can happen.
Right.
Almost we can say almost 100% of the patients, 100% of the population, sometime
Mm-hmm.
or other in their lifetime, they may have an
Mm.
arterial attack.
Right. Right.
Sometimes or other, they may have an arterial attack. It may be very transient for 5 4 days, but most of
Right.
the people are having a history of urticaria in their lifetime.
Mm. Right. Right. So everyone, again, coming back to the same point, understanding your body, understanding your skin, understanding the condition is very important. This is why we have got this platform for you all so that we can spread the awareness amongst people about such conditions which we tend to avoid at times. But today we are in discussion with Dr. Susmit Haldar. We are sharing some really amazing information today, and we are extremely glad to have him here with us. Doctor, quickly, we have another question coming up from the next viewer who asks, is urticaria curable? Is it curable?
Uh, 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 if I have a question in other way to that person who is asking this question, is
Right.
diarrhea curable? Is diarrhea curable?
Hmm.
Same thing.
Right.
Diarrhea can happen any number of times in a patient lifetime. So articulate in that way. When it is not there, if we can call it as a cure, it's a cure. If it appears again and again, and if you tell it as non-curable, it is not curable.
Right. Right.
Do a
The next
person
question.
suffers
Yes.
only from one time, only in a lifetime, only one time of tonsillitis? We may have several types, but if it is
Hmm.
remitted, then we will be calling it as a cure. In that way, articuity has cure.
Right. Right. Well, I believe you have got your answer, Chandan Sharma. The next question comes from Dheeraj, who asks, does it affect sleep, or daily life?
Pardon? Does it affect the daily life?
Does it affect our sleep, or our daily
Oh,
life?
of course, of course. There are certain conditions where patients are really tossing on the bed because of itching. They have
Mm-hmm.
sleepless night for days. That can happen also.
Right,
Today itself in my practice, I have seen a patient. She cannot sit properly in front of me. She's just goes on scratching the whole body. I've got a patient
right,
today.
right. So, our advice again for all of you is not to prolong the condition so far that it becomes tough for you, also for your expert. Just don't prolong the condition. Try and get it cured in the initial stage. Always, always the best option for you. The next, and I believe the last question for today's session, Doctor, comes from Tanishka Rajoria, who asks, are there any home remedies for the same?
No, no.
Right.
Straight
Well,
away answer is no.
right, right. Anushka, I believe there such things should always, always be taken care under expert's guidance. Please do not try any over-the-counter medications. Again, we repeat: no over-the-counter medications and no home remedies. Can't be possible. Well, it was a wonderful discussion with you, Doctor, today. We had a great time, got to learn a lot from you. Before we take a leave, any take home message for our viewers who has watched us so far?
Should I give the take home message?
Sure, Doctor.
The thing is that if you have an urticaria, whatever the foods I have just now described, try to avoid those and try to consult the dermatologist as early as possible.
Right.
Don't try to take any over the counter medicines. It is risky, detrimental also, because nowadays the patients may get oral corticosteroids also without any advice of the doctor. So over the counter medicine should be prohibited, and
Hmm.
there is a need for mass awareness regarding that. uh, over the counter medicine should not be given. If there is any angioedema like eruptions, or there is any suffocating feelings along with the arterial rashes in the body, don't waste time. Try to go to a nearby hospital or a nursing home for a emergency management. That time it requires an emergency management. So that is a very important point that we have left in discussion, but right now I am telling. So that is very important also. If there is any suffocating feeling, the patient cannot take breathe properly, along with there are eruptions in the body, immediately rush to a hospital or nursing home for emergency management. This is very important. And another important point, the patient, when the doctor has prescribed oral antihistaminics to take continue the medicine, there is a
Hmm.
tendency from the patients to stop the medicine and to experiment by themselves whether the condition has improved or not. It should not be done. It has to be continued till the doctor asks you to stop. This is another important take home message also.
Right.
Thank you.
Well, that was the expert advice for today, and that was Dr. Sumit Haldar for us. Thank you so much, Doctor, once again for your valuable time. It has been a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and the near and dear ones from getting urticaria. And in case they get to see such symptoms, they now know instead of self medication, it's always better to approach a nearby dermatologist. Well, it was great to hear from you, and we look forward to many more such sessions. Also, from the viewers, we got a lot of questions which were repeated. We will request you to please watch the recorded video because it will be really helpful for you all. Thank you so much, viewers, for your participation today. And for such updates on your skin and health, do like our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.